name is AJ Skoczynski. Today we're going to be talking about the heart. We're going to be doing this through a couple different segments, but the first one we'll just talk about the basic parts of the heart. It's got 4 main chambers in it. It's got 2 atriums, 2 ventricles. It's got a right atrium and a right ventricle. It's got a left atrium and a left ventricle. On the right side of the heart is your right-sided atrium and ventricle, and on the left side you have the left atrium and the left ventricle. The left side of the heart is pumping blood throughout the whole body, and the right side is just taking it from the bottom, from your heart to the lungs, back to the left side of your heart. So it requires a little bit less muscle mass to do so. When blood comes back to the heart, it flows back by way of the inferior and the superior vena cava. Blood goes into the right atrium. At the bottom part of our right atrium, we have an atrioventricular valve that we have to call the tricuspid valve. That valve allows blood to flow from the atrium into the ventricle, but not back into the atrium. So the blood goes down into the ventricle, and in the ventricle it kind of sits there and waits and waits. And once there's enough blood in there, the heart will squeeze, and from there the blood will flow out through the pulmonary artery to the lungs. Once it comes outside of the right atrium, it splits off and goes to the left and the right pulmonary artery, respective to each lung that they're going to. Inside the lung, their blood's going to get reoxygenated and try to return to the heart by the way of the pulmonary vein. From the pulmonary vein, it's going to go to your left atrium. Inside your left atrium, it's going to sit there and kind of pool in until the atrium gets ready and it gets full, and at that point, it'll depolarize and push the blood from the top part of the heart into the lower part of the heart, which is called the left ventricle. When it's going through the left atrium into the left ventricle, we have another atrioventricular valve that we call the bicuspid valve. It does the same thing as the tricuspid valve does, but does it on the left side of the heart. In the ventricle, once it decides to depolarize, blood's going to travel out through the aorta and out to the body. It's going to circulate into the body by the way of arteries, out to the capillaries, which will return to the heart once it's done the capillaries to the vein, and those will flow back into the inferior and superior vena cava, and the process just keeps repeating and repeating. The electrical parts of your heart start in the SA node. The SA node is firing between 60 and 100 beats per minute. From the SA node, it travels down to the AV node, and then into the bundle of His. From the point of the AV node where it stops branching off to the bundle of His before it branches off, it's called the AV junction. From the AV junction, it goes to the left bundle branch or the right bundle branch. The left bundle branch is on the left side of the heart, and the right bundle branch is on the right side of the heart. From there, it's flowing downwards to the bottom part of your heart into the Purkinje fibers, and the Purkinje fibers are firing at 20 to 40 beats per minute. I forgot to mention this earlier, but the AV junction fires at about 40 to 60 per minute. When you're looking at an EKG, your SA node is where you're going to see your P wave. Once the electricity goes into your AV junctions, where you're going to see your PR interval, and once it's going down to your bundle branches and your Purkinje fibers, that's where you're going to see your QRS formation. So we've talked about some basic functions of the heart and some of the more basic electrical stuff behind the heart. I've learned today that my iMovie skills aren't what I thought they used to be, and I should probably practice with it a little bit more, but I hope you guys enjoyed this.